When you think of healthcare, your feet might not be the first thing that comes to mind. But for nurse Lisa Fletcher, it's a critical part of her practice. She's been a nurse for more than a decade, and for the last 4 years, she's worked as a foot care nurse at the Saskatoon Community Clinic, where she sees a wide variety of patients. She also runs a foot care business, and that's why she knows the reality. When someone is struggling to afford the basics like food and housing, foot care often falls by the wayside. Lisa joins us now to talk about her work and her upcoming fundraiser. Good morning, Lisa.
Good morning.
What are some of the most common issues that you see at the clinic?
I see a variety. Lots of my patients come in for involuted or ingrown toenails. They do struggle sometimes with heavy callousing, corns. Sometimes I'll even have the odd issue of we have diabetics, so they'll have the brink of ulcers starting. So we try to intervene before it gets out of hand.
What about things like mobility issues?
Definitely. So that's probably a large part of my population. Many of them just cannot reach down to their feet. I know even with myself, when I was pregnant with my last child, I just couldn't reach my toenails and needed my husband's help. So lots of them, it's just age or even certain issues, knees, hips being replaced. Sometimes even just other issues that they just don't want to deal with it, or it's something that they don't even have the equipment to deal with it.
Can you tell us a little bit about some of the risks of untreated foot conditions?
Certainly, yeah. So lots of times people will kind of even opt out to go for certain pedicures. And sometimes if the equipment is not sterilized properly, then they run the risk of developing an infection, even getting nipped, poked, which can spread. Sometimes if these are not treated, it can lead to ongoing issues down the road with sores developing, lots of times with diabetes, especially anyone who is high risk for developing foot ulcers, foot sores, if they aren't being treated properly or aren't filing down these calluses early on, then they can develop into something major and end up in the hospital having to have surgery or even possibly amputations if it's gotten that bad.
And I imagine that you've also seen people who have been affected by the impact of frostbite on their feet, hey?
Yes, unfortunately. And with the winter months coming, and we're already in it right now, frostbite happens within seconds sometimes, depending on the wind chill and just the weather conditions. So sometimes we have people that don't even know they've got frostbite because they've already had altered sensation to these digits, like their fingers, toes, even ears. And so then they'll end up in the hospital, and sometimes it's almost too late for us to intervene, and they'll also have to end up with surgery and having amputations.
I think for most people who are perhaps struggling to afford food or housing, something like foot care, just having good shoes or good socks, it can feel, I imagine, like a bit of a luxury. So what is the impact of this gap in care?
Yeah, I am with a bunch of other nurses, foot care nurses, that we are trying to advocate right now to try and get some assistance in collaborating with insurance companies as well as anyone, I guess, to get more information out there that foot care is a necessity for lots of people, and it doesn't affect just you. It can affect your grandma, your mom, your dad, anyone basically, and especially the vulnerable population. They don't have the funds for this, right? So we have put up a petition to try and get signatures to lobby these companies to try and increase the benefits for many people.
And you've also worked with the Lighthouse before, offering foot care to people who have experienced homelessness. Well, I'm really curious what that experience was like.
That was a few years ago, and that was with a foot care company privately. And it was amazing. I loved offering the care to these guys and gals because they just loved it. I felt like they valued the care I was providing to them, and they would constantly be coming back monthly. We would set up a clinic monthly, and it was that was their one thing to look forward to. And once we could get their feet manageable and that they weren't sore walking on them, it's it made a huge difference to them.
Now, you started your own foot care business. You have plans to visit patients at home and see a diverse clientele. Why feet? It's not something that you hear about a lot. So why is it something that you've kind of taken upon yourself?
Yeah, I don't know. I've I started out doing nursing, and for some reason I found a course that was offered at the university, and then I kind of ventured out and did the advanced foot care course, and I've just loved every minute of it. I get to spend a little bit more time with my clients. Sometimes just doing the foot care on them is great, but it's them just like telling me their stories. It's almost like we have a bit of a social work session. I'm not a therapist at all, but I feel like sometimes if they can verbalize certain feelings or certain things that are happening to them that someone's not going to judge them about, or, I'm not telling them all this advice of what they should do, then it helps. So yeah, and then they get their feet done and they feel great, right?
Yeah. Now the fundraiser event on Friday will help support your work. What can people expect if they attend, and how are you hoping to use some of those funds?
Yeah, so it is tomorrow, 6 to 12 at the Capitol Music Club. So we have a supper set up. Unfortunately, those tickets are out, but you can still come around 8. I've got some band tickets left, and I've got 3 good musicians, Sammy Lee Fogerson, Rob McIntosh, and then Matt Johnner. I've got numerous raffle items, silent auction items. It just hopefully be a good time. Funds raised will go hopefully towards me providing products, socks, hopefully even if I get enough money, shoe wear. I'm hoping to partner up with some businesses throughout Saskatoon and maybe do like a drop-in clinic, maybe monthly, depending on what's going on. But yeah, hopefully help out some of these individuals that deserve it.
Lisa, I really appreciate you coming in and also the work that you do. Thank you.
Thank you so much.
That's nurse Lisa Fletcher. Her fundraiser takes place this Friday evening, featuring live music, a silent auction, and more. She mentioned proceeds will help provide essential foot care supplies to those in need.